Welcome to our surgical site infection prevention talk about preoperative skin washes. As you may know, global and national guidance for patients is that they should have a wash or shower the night before or morning of surgery. Some hospitals advise both night before, including hair wash, and morning of surgery. This is because most surgical infections, or SSIs, are caused by bacteria from the person's own body getting into the wound during the time of operation. So the aim is to reduce the number of microorganisms present. Briefly, the steps for preoperative washing start with asking about and documenting any patient allergies. Next, check or ask the patient about any breaks, rashes, or other skin concerns, such as eczema. There may be an alternative skin wash solution to use for patients with skin conditions, but always seek advice if you are unsure about skin conditions or which products to use. If necessary, remove hair from the planned operative site with electric clippers. Do not remove hair using a razor, as this increases the risk of SSI. The patient should be advised to stop shaving 2 days before surgery. Hair should not be removed to prevent SSI. According to the available evidence, body hair removal does not prevent SSI. However, the surgeon or local hospital protocol may ask for hair to be removed, or it may be a patient comfort measure. For instance, if there is going to be a strong adhesive dressing applied after surgery. Removing body hair from the operative site will also help the skin prep solution applied in theatre to dry faster. If hair is removed, use electric clippers. Clippers should leave a short hair stubble rather than a smooth close shave, because the aim is not to abrade the skin as shaving would. At this stage, if necessary, remove any adhesive residue from dressings or electrodes by using a suitable product. Before sending the patient for a wash or shower, you will need to check the facilities first. Make sure these are clean and in working order. Once you have done this, make sure the patient has everything they will need. For example, liquid soap or antibacterial solution, disposable washcloths and 2 clean towels, and a clean gown for putting on afterwards. If applicable, make sure there is fresh clean linen on the bed or trolley. They will also need clear instruction on how to use the product, particularly if it is an antimicrobial wash, such as how much to use. Make sure you offer assistance for patients who might need a bit of help. Washing is a personal activity. Full assistance is often not necessary, and it may be appropriate to ask the patient to turn off the water, wrap in a towel, and call for assistance with washing their back or lower legs and feet. Patients should be advised to wet the body prior to applying the solution, and should wash the skin firmly using the washcloth, but avoid scrubbing or rubbing the skin too hard. They will need to clean the body in the correct order. First, clean the body area planned for surgery, then the face and hair as appropriate. Next, clean outward from the anticipated surgical site, working from chin to feet, paying attention to skin folds. Clean axilla, groin, buttocks, and between the toes last. If they are using an antimicrobial soap, they will need to apply approximately 25 ml of the product, undiluted, to damp skin, stepping out of the shower stream for 1 minute for the product to work. This is because the antimicrobial solution needs time to be effective against microbes, and if it is rinsed off too soon, it may not have time to destroy the bacteria. After showering, the patient will need to dry their skin well in the same order as washing, starting with the area planned for surgery first, and using 1 towel for upper body and 1 for lower body, before putting on a clean gown. In summary, the key points for preoperative washing are to check for any allergies or skin conditions. Do not remove body hair to prevent SSI, but if it does need to be removed, use electric clippers and leave a short hair stubble rather than pressing the clipper onto the skin. Check that there are clean and working facilities, and ensure that your patient has clear instructions for preoperative washing and the offer of assistance if needed. Finally, please remember that in order to be effective, antimicrobial washes, for instance those containing chlorhexidine or octenidyne, must be applied undiluted to damp skin and hair, avoiding the water stream for approximately 1 minute before rinsing off completely.